Hi there, Kirk Euler back with you. More data. So I've been wondering, what are our actual death rates in comparison to all deaths? And so what we're going to look at today is in the 5 complete months of March, April, May, June, July, where we've been impacted by COVID. What do the death statistics really show us here in Placer County? Now again, this is just Placer County specific data, so your county obviously is going to vary, but here's some good questions for you to ask if you don't live here in Placer County. So let's start with total deaths over the 5-month period. So again, March through July, 5 months. You want to step in here, you can see how absurdly small this type font is, but that's just so I could get it all on 7.5 pages. So in Placer County, we had 1,300, exactly 1,300 deaths during those 5 months. So 1,300 deaths in 5 months. Not all of them are COVID. What is one of the single largest categories that we have of deaths here in Placer County during that 5 months? Well, again, very small type, but oh, hey, here's an important thing I forgot to mention. All the way down here at the bottom, this is important because this is a theme that's going to go all the way through. See what that is? That's the average age, 77 years old. Average age of our residents passing away during that 5 months, 77 years old. That theme is important as we go through. So sorry for the jumping back and forth. Cardiovascular disease, cardiac arrest, cardiopulmonary disease, anything having to do with the heart. We had 251 of those deaths during the 5 months. 251 people died of some cardio-related, some heart-related, average age 80. So among all deaths, 77. Among these deaths, average age 80, hanging out right there in that number. These are all causes of communicable diseases and unknown, okay? So our communicable diseases, we had a grand total of 61 deaths by way of communicable disease. We had unknown, another 100 unknown. Why am I throwing the unknown in there? Because even though it says unknown as the category right now, they identified cause of death. And under the causes of death, this says communicable disease, then they list other things like pneumonia. Well, this says unknown, but then they list other things like COVID-19. So even though the final determinative cause of death isn't here, they've identified different causes here. So in order to be accurate with the data, since we already have COVID cases, these yellow lines are each COVID cases, and then this red line right here is a COVID case, within the unknowns, in order to match up with our total number of COVID cases, we have to count all 161 either communicable diseases or unknowns in order to keep our numbers straight. So what's that telling us? 61 deaths by way of communicable disease. Well, how many of those were COVID? Great question. Come in here a little tighter. So here's what we're dealing with in Placer County. These red, those written in red right there, 9 are COVID, not including pneumonia. Red with yellow are COVID, including pneumonia. So 16, 9 pure COVID, no pneumonia. Another 7 COVID plus pneumonia. What's this right here? 13. That's pneumonia without COVID. We had 13 deaths by pneumonia in those 5 months. Without COVID, we only had 9 deaths of COVID without pneumonia. In other words, our pneumonia deaths were almost 50% higher than our COVID deaths. Did you hear anybody wanting to shut down the county over pneumonia? I didn't either. So, again, now let's compare this to our total communicable diseases. 16 deaths by COVID, 61 communicable disease deaths that include those COVID numbers. But again, some of those sit down here, so that's 16 out of a universe of 161 deaths. At least 45 of which we know are communicable, not COVID. Did we shut down the county over those 45 deaths that were communicable diseases, but not COVID? No, we didn't. We didn't hear anybody calling for that. How does this compare to something, I don't know, completely random, like accidental deaths? Glad you asked. 25 accidental deaths. 16 COVID, 9 pure, 7 with pneumonia, 16 COVID-related deaths, 25 accidental deaths. See this number 14? Fall. We had 14 people die from falling. 14 people die from falling. 9 people die from COVID, absent pneumonia. Average age of the people who died, pneumonia and COVID, 78. What was our average age across the entire universe? 77. What was our average age here? 80. Average age here? 78. Here's the real tragedy, and this is what our board keeps trying to get us focused on. We are no longer talking about public health. All we're talking about is COVID. We're no longer talking about all these other things. We're shutting down gyms, forcing people outside so that over 250 people can die of heart-related diseases here in Placer County in 5 months. But what's the real tragedy? What's the health epidemic that we're not talking about at all? It's suicide and drug overdose. And in the time that we shut down our county, over 9 pure COVID deaths, 16 if you count the COVID plus flu. At the same time that we shut down our county over that, we had 47 people die in this county. 47 of our fellow residents, 3 times the number of COVID deaths, dead due to suicide and drug overdose. 47 people whose average age is 48 years old. 30 years of life lost compared to everybody else. But all we care about is this. That is not managing public health.